Welcome to Chillin' 101. We hope this video helps.
You begin while seated comfortably. You want good posture and a clean surface. Connect the Charge Dr. Jim wearable pump and snap on a sterile bottle. Make sure the flange seals flat against your breast. This prevents leaks and improves suction. Press power and select a soft stimulation mode first to trigger letdown, then switch to expression mode once milk flows. Adjust intensity slowly. You should feel suction but not pain. Once done, note collection volume and set a timer for your next session. Once milk starts, refine settings to sustain flow and comfort. You increase intensity in small steps to match your letdown rhythm. This preserves nipple tissue and boosts yield. If flow slows, alternate short bursts of higher intensity with gentler cycles to mimic a baby's pattern. Empty one breast fully, then switch sides, or pump both simultaneously if you prefer. Make sure membranes and valves sit snugly. Poor seating reduces vacuum. After finishing, power down. Remove bottles and cap them promptly for storage. You complete the session by gently detaching the pump and capping bottles. Label with date and time before storing. Clean parts that contacted milk right away using warm soapy water and air dry on a clean rack. Sterilize daily if infant is under 3 months or immunocompromised. For persistent low suction, check that the silicone valve is undamaged and the membrane lays flat. Replace it if warped. Also make sure the unit is fully charged and the flange size is correct for your nipple to restore proper vacuum.
Thanks for watching. Consider subscribing if we helped you.